Hello, and welcome to the Washington State Division of Child Support webinar presentation of Using Digital Marketing to Increase Participation in the Washington State Child Support Program. Let's talk a little bit about who our team was for this grant. Myself, Christina Blessi Hayes, was the grant manager on this, as well as several others prior before me. We also have Ann Byrne joining us from the Center for Policy Research and Maggie Spain with Spirica Communications. Our 5 main goals for this grant were to increase awareness of our child support services, also to increase the number of people visiting the DCS enrollment page, and increase the downloads of applications, as well as increasing the number of non-assistance cases and changing DCS's general approach to advertising through fee-based digital marketing methods. As a part of this grant, we had 3 main interventions. The first intervention focused solely on Facebook-sponsored ads. That intervention ran from April 16th through June 28th of 2019. We then moved into our second intervention with PEACHJAR emails. That intervention ran from September 29th through December 31st of 2019. And finally, leveraging lessons learned through the first 2 interventions, we began our third intervention. This lasted from August 3rd through October 11th with iHeartRadio streaming audio ads.
DCS approached this by targeting 8 counties within the state. They looked at the uptake rates of services across the state and selected these 8 counties as ones that could use more clients. Within those 8 counties, we went further and targeted zip code areas where it appeared that the number of current DCS clients was smaller than in other parts of the counties. So we looked at what we called the lower utilization counties, and that's what the targeting that we used for the first 2 interventions. During the third intervention, we decided to try another experiment, which was to compare those low utilization zip codes with higher utilization zip codes.
Our creative approach was based on qualitative research conducted by the global PR firm Ogilvy for the California Child Support Program in 2018. Ogilvy conducted focus groups with parents and staff of the Child Support Program to glean feedback on their opinions of the program and its communications materials. The firm also audited the materials presented by California Child Support. And we found a variety of things in this report that really were used for the development of our creative. The first thing was that applying for child support is not a happy event for parents. There's a lot of sadness, shame, fear, and vulnerability associated with applying. As such, it's important to not highlight happy, intact families in advertising because those families are not applying for child support services. The second element is that child support is a transactional, service-oriented relationship. Helpful and clear step-by-step guidance on the process to apply for services and the resources that are involved when you open a child support case are really important for parents who lack a general awareness and understanding of the child support program. With advertisements and communications materials, child support agencies should not offer parenting advice. The focus needs to be on the direct service provided from this relationship. And finally, it's important for child support messaging to focus on the needs of the parent applying for services, not necessarily directly the children. It's important to disregard child-focused messaging or broad brand messaging for the agency and instead address the myriad of challenges that parents might be facing and position child support as the agency that can help them alleviate some of those challenges and improve their lives. Our first intervention was Facebook-sponsored advertising. During this intervention, we ran 2 creative groups at random in our 8 counties participating in this project and tested the performance of the creatives against each other. On the left, creative group 1, this ad included a stock photo of a mom doing a piggyback ride with her child and text for the post text, which directly connected to the image. The idea with this ad was to briefly engage people into the value of the child support program and the services that are offered, and ask individuals who are scrolling their Facebook news feeds to click on the link to apply for services and ask DCS about their options. The second creative group on the right utilized an infographic image and a checklist of the services that are available when a parent opens a child support case with DCS. The idea was that when parents open a case, they can access many different services to help them better support their families. Like the first ad, this creative group also positioned DCS as a helpful, family-focused agency. Our second intervention, PEACHJAR emails, utilized 3 different flyers seen on the screen that ran over a 3-month period. PEACHJAR is an email service used by K-12 schools nationwide. It replaces the traditional Friday folder model. On a monthly or weekly basis, schools send information to parents, and advertisements from community agencies are attached to those messages. Our first PEACHJAR flyer, Boost, included a similar photo to the first Facebook ad of a mom giving a piggyback ride to her child, and used a probing question to engage readers to find out more about the services available through DCS. The second flyer, Future, seen here on the middle of the screen, used a photo of a father with a child and a message that engaged people into a checklist of all the various services that are available when someone opens a case with DCS. With both of those first 2 flyers, we sought to create some urgency with our call to action and encourage people to either contact DCS now or see how DCS could help them today. Our third flyer for PEACHJAR, Change, seen here on the far right of the screen, was a little bit of a different approach. Instead of focusing directly on applying for services, we sought to engage people who may already have a child support order and might be in need of order modification. Included on the right side of this flyer is a checklist of questions that individuals would need to ask themselves to ascertain whether or not it's important for them to request a review of their child support order. And at the bottom of the flyer, we included information about how to request a review.
The difference in the comparison between the 2 or the 3 different PEACHJAR flyers pointed to an interesting result. We found the first one and the third one performed relatively similarly, but that the second one, the Washington Kids Deserve a Bright Future, with a picture of the father and the child, actually didn't perform as well. What we determined, and best we could assess, is that that broad branding statement of Washington Kids Deserve Bright Futures was not as compelling as the questions that were asked in the other 2 flyers. That was consistent with the Ogilvy report, which suggested that branding statements are not as effective as what is of interest to the parents themselves. It was more child-focused as opposed to parent-focused, and there was a picture of a father and a child versus a mother and a child or children alone. So this was a significant difference. We can't completely conclude that those were the reasons, but it does reinforce what Ogilvy suggested in terms of the type of messaging that you do.
Like many other agencies that participated in the digital marketing project, the state of Washington was greatly impacted from COVID-19 and the participation and creation of communication plans for our 3 interventions. We experienced several project delays. It started in March of 2020 when the DCS field offices were closed as a result of the pandemic. Our planning team made the decision to push the 3rd intervention to August of 2020. And in that time, we did some internal surveying to understand how people apply for child support and what strategies we may need to implement to mitigate the effects of the pandemic. Internal surveys revealed that 40 to 44% of non-assistance applications in the state of Washington were submitted from walk-in visits to DCS field offices. We don't know exactly why this percentage is so high. Some hypotheses were made related to fewer people having printers in their homes, the cost of mailing items, and just the fact that applying for child support can be very complicated. And oftentimes people want to interact with someone to ask their questions. So understanding this percentage, we sought out to figure out some strategies and implement them to make sure that our third intervention would be as successful as possible. The first thing we did was we recut the iHeartRadio streaming spots to acknowledge the stress that the pandemic was posing on Washington families. We also added a call out box to the DCS Enroll for Child Support Services webpage to direct people to a phone number and email address for help. The DCS team created an application how-to video that was posted on YouTube, and it provided a step-by-step guidance for applicants to fill out the non-assistance application. We also added an online form on the DCS webpage that allowed parents to request mailed applications so that they could receive the application at home, fill it out, and return it in a convenient manner. So when we ran our iHeartRadio intervention, it did finally begin in August of 2020, and it included a 30-second streaming spot that ran on station websites throughout the state of Washington, as well as the iHeartRadio mobile app. Here is the spot.
In this time of uncertainty, we know things aren't easy for single parents. Washington State Department of Social and Health Services, Division of Child Support, is here to make things easier for you and your child. When you open a case with us, you can access many services to support your family. We help you collect money you can use on clothes, food, or school supplies. Get started with child support now at childsupportwa.com. That's childsupportwa.com.
The banner you're seeing on screen alongside the 30-second iHeartRadio spot accompanied the ad when individuals were either in the mobile app or also on a station website. They could click on that link and go directly to the DCS Enroll for Child Support Services webpage. The unique thing about iHeartRadio as a digital marketing method is that it provided two options for interaction in the call to action. Individuals who heard the spot could either click on the banner ad or type in the URL that was referenced twice at the end of the commercial. DCS created two different vanity URLs for this campaign to make it easier for people to understand and remember the URL, no matter where they were. If they were in their car, somewhere else in their house, it was much easier to remember wachildsupport.com or childsupportwa.com than the traditional long trail government URLs. What we saw with our three interventions is that all three of them drove an increased engagement on the DCS web pages. The impact was quite immediate. As Anne mentioned previously, transactional focused messaging and creative featuring a mother and a child or children on their own performed best throughout this project. Similarly to the interventions, as soon as we made updates to the DCS webpage, those updates had immediate and positive impact in the way individuals interacted with different pages on the website. After our third intervention, we conducted a survey, and direct feedback from respondents indicated that the advertisements used in our third intervention provided new information and improved the overall image of DCS among applicants for child support services.
The three interventions that we deployed in Washington provided an interesting contrast to one another because of the different nature of the platforms. So in Facebook and on iHeartRadio, you had the option to click on the ads when it appeared in your feed or on your screen. So it was immediate. You could go as you saw the ad and go directly to the page that was directed to the Enroll for Child Support page. But with PEACHJAR and then also the memorable URL aspect of the iHeartRadio, the listener or the viewer had more control over when they actually went to visit the website. So with PEACHJAR, the flyer was often sitting in someone's email box, or they could go to the school's webpage and access the flyer later after seeing it for the first time. And the memorable vanity URLs were intended to kind of put themselves in people's memory so they could go back and view the website at their convenience. So we were able to kind of compare and balance the two different types of platforms, the one where you had to react immediately and also the ones that were more static. Both of them have advantages. If it's a clickable ad, when people appear, it enables a broad distribution and engagement. We got a lot of clicks on those ads. It generally attracted new visitors. And I mean generally as in 95% of the people who clicked on the ads were generally new to the child support website. Those interactions were generally very brief as well. So people came and left quickly, but those are some of the attributes of those clickable ads. With the more static ads, it was generally a narrow distribution and fewer people engaged, but it did prompt more repeat visits. And the engagement that they had tended to be longer and utilized they went to different pages and they just spent more time on the web page, which we consider to be a positive indicator of engagement. And again, their ability to go to the website was driven by their desire and timing, as opposed to when the ad appeared on their feed or with the radio. So Maggie mentioned the web page changes that were made with each intervention. And with the first two interventions, they were sort of incidental as we were preparing for the interventions. The first one was adding a call out button about applying for services to help people navigate the web page from visitors who just came to the DCS main page to get to the apply for services site. In the second one, we changed the word apply to enroll to see if that made any difference in how people responded. And then we also simplified the language in the Enroll for Child Support Services page to make it easier for people to figure out what the steps were to applying and what forms they needed to download and the like. Some of the language was a little bit confusing to people to understand what a non-application or non-assistance application meant. If you weren't familiar with those terms, it was hard to know which one you should click on. And the third one included the things that Maggie mentioned, which was a training video on how to fill out an application, and then an online form where you could request a mailed application so that you could then fill it out and submit it to Child Support Services. As Maggie mentioned, we found that those particular updates had a pretty dramatic impact on the way people engaged in the website. Some of it is our ability to track this information very closely within Google Analytics, but what we found is that we were able to increase the transitions from the main page of the DCS website to the enroll page by 3% just from having that call out box. In the second intervention, with the simplified language on the web page, we saw that the transitions to the frequently asked questions page decreased by about 15%, which we consider to be a good sign because it suggested that people found out the information they needed on that enroll page and didn't need to look further. In the third intervention, there were many clicks on the how to apply video, which was a great kind of step-by-step, here's how you answer this particular question, or what is the information you need on that. And then a big response to the email request for applications during the third intervention. And again, those last two were added in response to the offices being closed and the recognition that many people actually were submitting their applications in person at those offices and trying to figure out ways that we could support people in the application process when they could not go to the offices. Maggie mentioned a survey that we did during the third intervention. We were able to send an invitation to participate in a survey 2 new applicants from the targeted zip codes that the intervention was directed to. And they were invited by child support to participate, given a link to a survey that was online, and offered an incentive by the Center for Policy Research for filling out the survey. We got a great response, and it was really interesting, the information that was provided. Across the board, the main reason people said that they were applying for child support was needing financial support from the other parent as their primary motivation for why they applied. We gave them a list of multiple options, and that one clearly came up as the top option. For the most part, most people described their experience of applying for child support as easy and found the information that they needed on the DCS website. So that was a great reinforcement that the webpage, as it's set up now, was effective in reaching most people. Not many people recalled seeing or hearing a digital ad, which wasn't surprising because the recall of ads you hear or see is really very low. But those that did say that they remembered seeing an ad said that the ads provided new information to them about child support services, especially that DCS can provide financial help for families and can collect child support. Most viewers who said that they did hear or see an ad said they clicked on the ad or they visited the web page later, and that the majority of those people who said they saw or heard an ad said that it positively influenced their decision to apply and improve their opinion of child support services. So one of the things that we were doing in the third intervention was looking at the differences between the 2 targeted groups. The same ads were played in the different zip codes that we put into each group. The only difference was the different in the URL, the vanity URL. And because of that, we were able to track their responses very comprehensively in terms of how many people responded to each ad. We did find that there was a difference in many different ways between the higher utilization group, or the group of zip codes that had consistently more applications that came in than the lower utilization groups. We knew that both of the groups had comparable median incomes, and that we knew that the higher utilization group had slightly higher average number of single parents in those zip codes. There probably are a lot of other factors that were different or similar about these groups, but those were the things that we knew to be based on the investigation that we did. What we found is that the higher utilization group, or that group who had more existing custodial parents already in those zip codes, made a lot more applications in both the baseline and in the intervention periods. We looked a little bit to see if that could be accounted for by the number of single parents, but it was way beyond that, so that we know that there's something else going on relative to why that group was more likely to submit applications than the other group. We did see from the survey results that the higher utilization group had a lot more knowledge, familiarity, and experience with child support services. So maybe they actually had a previous case. They were more familiar with the services that were provided and just knew more about what child support services was. They had a lot more ease in the application process, and this was fairly dramatic. 77% of those in the higher utilization group said that the application process was easy, compared to 50% of the low utilization group who said it was difficult. So this is important. As you recall in the previous slide, overall, the survey respondents said that they found the process easy, but this low utilization group did not say that. They said it was a difficult process. The higher utilization group had more contact with DCS during the application process. We asked, did you return to the website? How many times did you go? Did you call the office? And it was clear that the higher utilization group picked up the phone more often, felt comfortable coming back to the website multiple times than the lower utilization group. And then we also were trying to figure out why and what was different about these groups with the information that we could gather in the surveys. And so we asked if they had heard certain opinions or statements about child support. And the higher utilization group was more likely to respond that they had heard these opinions expressed. And they were both positive and negative opinions, or they were just statements about what child support provided, the services that were provided. The low utilization group didn't say that they hadn't heard them, they just didn't know. And so this was also just a reflection that there just was more familiarity and more kind of within their peer groups or social groups, knowledge about child support services. So these results were really fascinating and suggested that there is more opportunity to learn more about these two different groups and to figure out what makes them different and how to address both of their needs. The higher utilization group is already inclined to apply for services, and then you could use digital marketing to push them over the edge a little bit more or speed up the process, whereas the low utilization group really needed more basic information about child support. And so that even if you don't get the kind of engagement you might from the higher utilization group, it's providing a really important first step in the process. So for every intervention, we did look at the number of non-assistance applications that child support received from the targeted zip codes, and we compared it to the statewide rate of non-assistance applications for the same period, just to get a frame of reference. Now, we know that there can't be a relationship between digital marketing interventions and the application rates because we don't have an experimental project here, but this was still very interesting information for us to look at. So during the first intervention, the Facebook intervention, across the state, there was a 6% decrease in new applications. Now, across the country, child support agencies are receiving fewer applications, which was part of the intent of this whole project, was to stir interest in child support and encourage more applications. In our intervention area, we saw a 1% decrease. So neither had an increase. We were hoping for a 2% increase. This was the original goal that we made. Again, we can't make any conclusions about the role of the Facebook intervention, but this was interesting nonetheless. The next intervention, the PEACHJAR intervention, across the state, they actually had a 1.5% increase in non-assistant applications. And we were comparing the intervention period with the previous year during the same dates as our baseline. And interestingly, during the second intervention, our intervention area had a 4% decrease. Now, again, we can't say, that the digital marketing, the PEACHJAR flyers made an impact on that, but it did make us wonder a little bit about what was going on here. And so we did a little deeper dive into the application rates of the zip codes that were not in our targeted areas, but were in the counties that we were targeting. And so that was the first time we saw the dramatic difference in the different groups that we were looking at. So the groups with a higher utilization, we were targeting the lower utilization groups based on the notion that they had more need for child support services, and that those zip codes with higher utilization already were probably saturated with services. We found that wasn't the case, that those higher utilizations areas already had a high number of custodial parents relative to the single parents in the area, continued to recruit and have more applications. So we did that prompted us to look at the third intervention a little differently and to see what we could tease out about those two groups. And now I shared a little bit about what some of that was, but here you see the results, which are very interesting. So this was the third intervention was right in the midst of the pandemic. And so we totally expected applications to go down. And you see on a statewide level, they went down rather dramatically, 20% during that period during the intervention. I'm sure later on in the pandemic, they stabilized a little bit more, but during the period we were looking at, they went down 20% across a statewide level. And then within our intervention group, overall, we saw a 16% decrease in applications. But then when you break it down by the different groups, the high uptake group saw a decrease in applications of 13%, while the low uptake group saw a decrease in applications of 22%. So that's rather interesting and says more about the differences in these groups that, again, could be fascinating to explore in more depth. So looking at the three interventions as a whole and drawing some insights based on our knowledge about what happened and what we learned, and just it was an incredible learning experience. With everything we did, we learned something new. And what we found is that digital marketing appears to be effective in driving new visitors to the DCS website. We saw a lot of engagement, and any engagement was more than what was previous because all of the ads and all of the activities were effective in getting people to come to the website. What we also learned is that the expectations for outcomes, including increasing child support application rates, should align with the nature and limitations of the platform. So frankly, after Facebook and PEACHJAR, I felt a little bit discouraged and thought maybe we shouldn't have engaged in Facebook in particular, because while it prompted a lot of engagement, people came and left within seconds on the website. And so it appeared that, that didn't really do anything to lead to child support applications. How could it if they left so quickly? But then after the third intervention, it became clear that there is a group out there that knows very little about child support. And so if this was the first opportunity for people to learn about it, it was doing a valuable purpose. It provided a valuable information to people that might not know about child support services. And because it was so broadly out there in those communities that we were targeting, it got a lot of views. And so that was a useful thing. So again, it's just important to know what you're looking for. With the third intervention and the vanity URLs, we did see much more engagement. People came back multiple times, and we were able to track it because of the way that the URLs were set up. And so again, if you're wanting to target a particular population and that level of engagement, there might be other platforms that are more useful. And so whatever your outcomes are, it's good to align the platforms with those outcomes. And that, again, while there a substantial number of people who seem to feel like it's easy to apply for child support and to interact with DCS, others do not. And so more research into the experiences of that population would be helpful, so that you can provide the resources in a way that is going to be accessible and applicable to those individuals' situations.
As mentioned several times, the updates to the DCS web pages that were made throughout the interventions had measurable impact. Very clearly, we saw increased engagement, increased number of clicks on the call out boxes, completing online forms, and then fewer visits to the FAQ page, because we made changes to copy to make the process of applying for child support easier to understand. So the fact that fewer people were going to those FAQ pages was valuable, hopefully because individuals were getting the information they needed as soon as they reached the web page that they landed on. In addition, we found that the creative and short vanity URLs that were implemented in the third intervention for iHeartRadio were easy for people to remember and return to the website. Individuals who utilized those vanity URLs spent much more time on the DCS webpage and were also more engaged with different forms and placement to make sure that they got the information that they needed. The value of these two URLs you see on the screen, wachildsupport.com and childsupportwa.com, is that DCS purchased them. They have been integrated to the Enroll for Services webpage, and they redirect to the information that individuals who are interested in applying for child support need, and they should be utilized more in the future. A few other insights that we found through the involvement in this project is very clearly that digital drives everything in 2021. There is a need for a smooth transition from the digital advertising medium that's used back to the DCS webpage. You want to make the process as streamlined and easy as possible to ensure a better user experience. So that's why consistently throughout this project, we made updates and edits to the DCS webpage to make sure that the language used on the page was not jargony, eliminated a lot of different acronyms to make sure that individuals who had very little awareness of child support understood what the process entails. It's important to have an online application for child support services, especially when you're using digital marketing. So if you are advertising on Facebook or iHeartRadio, any type of digital marketing, and someone clicks on your ad to go to your website to apply for a service or receive a product, and then they're not able to finish that process online, that can be really frustrating. It adds another step for the applicant, and it potentially leads to fewer number of people actually applying because they're not able to do that online. So we strongly encourage DCS to create an online application for child support services. We saw that visitors to the DSHS website and the DCS web pages are coming from mobile devices. About 50% of all site visitors are coming from mobile devices, and that number is only going to increase in the years ahead. We also saw with our third intervention that there was a tremendous increase in engagement with online forums. And those online forums have significant value. They allow people to get the information they need online without taking that extra step of making a phone call or visiting a field office in person. And given the social distancing requirements of the pandemic, potentially as well, how people interact in the future, having this type of opportunity to engage with online forums will be very beneficial for DCS. With our creative messaging, we did find in each intervention that individuals were engaged with all of the creative. And the creative that was utilized for this project can be reused and enhanced in the future. One of the most valuable elements of PEACHJAR is that it's a free service. So DCS can continue to use it easily and frequently because of that. There is an importance of maintaining that transactional parent-focused messaging approach. As Anne mentioned when reviewing the results of our interventions, those creatives performed much stronger than others. So the core message of child support is here to make things easier for you and your child is key to drive future engagement for DCS in any different type of communication material. We would also recommend that DCS consider marketing strategies to existing customers and individuals who have that awareness of the child support program, especially those who need order enforcement services or would like to request a review for a child support order modification. In our survey following the third intervention, we heard from several applicants who were aware of the child support program because of relationships with private attorneys or previous engagement with the program. It's very clear that there are untapped audiences out there who have that baseline awareness of the child support program, and it may be easier to engage them because they have that baseline awareness and we're not starting from scratch to explain the program to individuals who have little familiarity with the services involved. And finally, we would also recommend that DCS continue using the vanity URLs that were created for iHeartRadio. The IT department has already set up those redirects on the website, and it's very clear that people remember those and they come back to the site over and over again. We're continuing to see engagement with those vanity URLs nearly 6 months after the conclusion of the iHeartRadio advertising campaign. And as previously mentioned, it is very critical to develop and launch an online child support application as we talk about future DCS webpage enhancements. It's that needed step for DCS to become fully digital. It's important for DCS to continue to update all web pages to simplify the process of applying for child support services and make the information accessible to anyone, no matter what level of awareness they have about the program. It's important that the online interactions that somebody has with the DCS webpage mirror what their in-person interactions might be with a staff member at the DCS field office. And finally, monitoring webpage activity within Google Analytics can play an important part in all communication activities because the data provided within Google Analytics in terms of how people are interacting with pages and components of the site really provide insight into usage and engagement. And that data should influence digital marketing strategies in the future.
There's no question that feelings, attitudes, and approaches to interacting with child support services are changing. All of our findings and insights you've heard about today will continue to shape the way Washington State moves forward with our future marketing interventions. If you have any additional questions regarding the material you've heard or seen today, please feel free to reach out to either myself, Christina Blessi-Hayes, or Ann Byrne or Maggie Spain at the email addresses listed here. Thank you for taking the time to view this webinar.